We present to you in this video how to fever cure at home for children and adults at home. Fever can be treated with simple methods and medications at home. Fever is a temporary rise in body temperature, and it is one part of the overall response issued by the body's immune system. Fever usually occurs due to infection or inflammation. Most children and adults may be bothered by fever, but it is usually not a cause for concern. As for infants, a fever, even a slight increase in temperature, means a serious infection or inflammation. A fever usually goes away within a few days, and a number of over-the-counter medications can be used to lower the temperature, but you don't need to treat a fever if it's not causing discomfort. You can follow some of these tips. Drinking plenty fluids improves the dissipation of heat through the skin and replaces water lost during sweating. Healthy options include water and soups free of additives. As for infants under 6 months, they should only be given breast milk or formula milk. Also, the body needs rest to recover, while activity can cause the body temperature to rise. Keep your body cool. If you are not shivering, wear light clothing, maintain a cool room temperature. Fever treatment for adults. The treatment of fever for adults can vary depending on the cause of the fever. Treatment of the cause must begin first, such as giving antibiotics to the patient who suffers from infections. Methods to help treat high fever include the following. Drink fluids to prevent dehydration. The patient can take a bath using lukewarm water. Take enough rest. Use cold compresses. You must consult a doctor to treat fever for adults or children in the following cases. If the body temperature is more than 39.4 degrees Celsius, or the fever lasts for more than 3 days. If the patient suffers from an immune disease. If you have any of the following symptoms: severe headache, swelling of the throat, skin rash, sensitivity to bright light, stiff neck, persistent vomiting, abdominal pain, pain when urinating, or muscle weakness. Treatment of fever in children. Fever in children can be easily treated in most cases using medications and other natural home methods. However, a doctor must be consulted regarding treatment of fever in children under 3 months old, or when the body temperature rises significantly, or the fever persists for a long time, or other cases in which the fever could threaten the child's life. Infants may need to be hospitalized for tests and treatment, especially those younger than 2 months old. For children this age, a fever may indicate a serious infection. There are a sum of measures and methods that can help treat fever in children at home, including: the child gets enough rest. Apply cold water compresses to the child's forehead. Wipe the child's body with a tissue or sponge moistened with lukewarm water. Reducing the amount of clothes the child wears. Give the child plenty of fluids, including chicken soup and diluted fruit juice.